In the early 19th century, when medicine was still mired in superstition and surgery was synonymous with pain and risk, there lived a man named Thomas Hodgkin. He was a physician, a Quaker, and a humanitarian. His path led him from London hospitals to the most remote corners of the planet. He didn't merely treat, he delved deeper. In 1832, Hodgkin first described a mysterious disease. It affected the lymph nodes, slowly killing its victim. This disease would later bear his name, Hodgkin's lymphoma. This discovery profoundly impacted the medical world. It shed light on the mechanism of previously unseen suffering. Hodgkin became a pioneer in a new field, hematology. He was a visionary whose methods were decades ahead of their time. But his story didn't end within hospital walls. Destiny took him far beyond the operating room. He became a diplomat, an advisor to rulers, instrumental in the creation of a new state in West Africa. The physician who discovered a disease found himself at the forefront of geopolitics, building the future of entire nations. We tend to think of great discoveries as flashes of genius, solitary epiphanies illuminating the world from out of nowhere. This is a myth. Science is not a series of instantaneous insights, it's a long, arduous process. It's a path paved with errors, doubts, struggles, and often personal tragedy. Thomas Hodgkin's story is a vivid testament to this. Prepare yourself. We are about to delve into a world where medicine intersected with politics and humanity confronted the brutality of the colonial era. At the very beginning of the 19th century, as Europe entered the era of industrial revolutions, medicine remained deeply rooted in the Middle Ages. Ignorance reigned in hospital wards. Disease was considered an imbalance of the four bodily humors: blood, phlegm, yellow bile, and black bile. Any ailment, from fever to tumor, was explained by a disruption of this fragile balance. A diagnosis often sounded like a death sentence rather than the beginning of a path to healing. Treatment caused more harm than good. Bloodletting was a panacea, applied for any ailment. Patients were weakened to the brink of death, attempting to release the illness from the body. Emetics and powerful purgatives completed the picture of an already debilitated body. Hygiene was non-existent as a concept. Infections spread freely, passing from one patient to another, from the physician's hands to an open wound. Surgery? It was a nightmare. Operations were performed without anesthesia on conscious patients. Patients' screams were drowned out by the sounds of hammers. Amputations lasted mere minutes, but the pain endured forever. Wounds were cauterized with red-hot irons. They were doused with boiling oil to cleanse them. Pus was considered a sign of healing. It was called laudable pus, without understanding that it was merely the development of a deadly infection. Death was a frequent outcome, and survival a rare miracle. This was a world where suffering was the norm, and healing a fortunate accident. A world where a physician was more likely to witness agony than to fight for life. Into this world, steeped in pain and despair, stepped Thomas Hodgkin. He was young, and he was a Quaker. This was not merely a faith, it was a way of life. Quakers were characterized by deep compassion and a heightened sense of justice. They believed in direct apprehension of truth, rejecting dogmas and authorities. These principles shaped his view of the world and of medicine. He received an excellent education, studying in London and Edinburgh, mastering anatomy, chemistry, and physics. But his real education awaited him within the walls of hospitals. In the early 1820s, Hodgkin began working at the renowned Guy's Hospital in London, one of Britain's largest and oldest medical institutions. It was a place where he confronted reality. He saw it every day: bloodletting to the point of fainting, patients dying of fever after treatment with emetics, open wounds teeming with pus, which doctors called laudable, children screaming in pain during amputations. He saw the same mistakes repeated year after year. how methods based on millennia of misconceptions brought only new suffering. Other physicians took this for granted. Such was science, such was practice, but Hodgkin could not. His Quaker principles, his innate pursuit of truth, would not allow him to accept it. He began to doubt, not himself, but the very foundation of their world. The entire system of treatment, their whole approach to the human body, seemed fallacious to him. He didn't just see individual patients, he saw patterns. He sought answers not in ancient texts, but in living people. He began collecting case histories. He meticulously studied tissues. He sought causes. This was not a rebellion. It was a methodical, almost scientific refutation. He didn't merely resent. He analyzed. He compared. He documented every failure, every instance where their help resulted in death. He understood, to save lives, one must first understand why they are lost. It was necessary to transcend conventional notions, to view humans not as vessels of fluids, but as complex mechanisms requiring study. His path to revolutionizing medicine began here, in wards filled with pain and ignorance, with simple questions that no one before him dared to ask. Why? And what if everything is wrong? To the Guy's Hospital morgue came case histories written not on parchment, but on flesh. Thomas Hodgkin performed autopsies. He didn't merely confirm death, he sought life, the one that had departed. He sought the cause. His hands worked methodically, a sharp scalpel, a keen eye. He examined every organ, compared, recorded. It was here, amidst the scent of formalin and the silent testimonies of human suffering, that he began to notice something strange. Several cases. Patients had enlarged lymph nodes. But it wasn't tuberculosis. It wasn't syphilis. It was unlike anything he knew. Standard research methods yielded only a general picture. Tissues seemed uniform, but Hodgkin sensed something hidden beneath this uniformity. He needed to see deeper, at the cellular level. However, the tools for such detailed analysis, common to a modern pathologist, did not exist then. Microscopes were primitive, and reagents for clarifying tissues, allowing the examination of the finest details, were expensive or simply unavailable in sufficient quantities. Perhaps he simply lacked that very oil, not literally, but metaphorically, for a complete, clear vision. This became a problem. He could not tolerate the ambiguity. Rejecting conventional but ineffective approaches, Hodgkin decided to act differently. He began collecting lymph node samples from all patients with this mysterious symptomatology. He made the thinnest possible sections. He didn't just look, he compared them under a magnifying glass and then under a microscope, which was then more of a curiosity than a standard instrument. He sought a pattern, and he found it. In the 6 cases he meticulously studied, he saw the same thing. The enlarged lymph nodes had a unique, recurring structure. Under the microscope, he distinguished unusual giant cells that should not have been there. This was not an inflammatory process, not a common tumor. This was something new. His eyes saw what no one before him had seen. It was a moment of insight, not a flash of genius, but the result of persistent, systematic labor. He didn't just describe symptoms, he looked within, into the very essence of the disease. He isolated it from the chaos of other ailments. He gave it form. He gave it a name, for now only in his notes. This was the beginning of a new era in the understanding of blood cancer, the beginning of hematology as a science, and the beginning of his own incredible journey. This discovery could not remain confined to the morgue. Hodgkin understood the world needed to know about it. But how to convey this knowledge when most physicians relied on works written millennia ago? How to convince them when dogma was stronger than facts? He did not believe in ancient theories. He believed in evidence, in what he saw with his own eyes, in what the patient's body revealed to him. His method was empiricism, pure, unadulterated. He did not seek to confirm dogmas. He sought truth in flesh, in tissues, in patterns that others ignored. Each autopsy, each case of illness, each new detail discovered under the magnifying glass became part of his larger picture. He didn't just observe, he systematized. He compared. This was not an intuitive impulse, but methodical, painstaking work. He collected not just facts, but evidence that could dismantle established beliefs. In 1832, Hodgkin presented his observations to the Royal Medico-Chirurgical Society. This was not merely a presentation, it was a challenge to traditions, authorities, and millennia-old misconceptions. He published his report in the Medico-Chirurgical Transactions, the leading medical journal in Britain at the time. It was in his native language, without Latin flourishes, accessible to any practicing physician, to students, to anyone who wished to understand. He wanted his colleagues not just to read, he wanted them to see what he had seen, so they could replicate his observations. His toolkit was simple, but its application was revolutionary. A primitive microscope, which in those years was considered more of a curiosity or a toy than a serious scientific instrument, transformed into a powerful instrument of knowledge in Hodgkin's hands. He didn't just look at samples, he prepared them. Hodgkin honed the technique of creating the thinnest possible sections, perfecting it. This methodology was a breakthrough in itself. He spent hours comparing these sections with normal tissue, with other known pathologies, seeking the slightest deviations. He sought a unique pattern. This was a kind of invention, not of a new apparatus, but of a new way to see and analyze data. He understood that the quality of observation directly impacts the quality of diagnosis. And if the vision is unclear, one must find a way to make it transparent. He learned from mistakes, not only from others, but from his own difficulties. He saw how traditional methods, like bloodletting, led to the death of patients. He saw how pus was considered laudable, though in reality it was a harbinger of deadly infection. These observations didn't merely outrage him, they shaped his approach. He realized if old methods lead to suffering, then they must be discarded. If the diagnosis is incorrect, the treatment will also be detrimental. When his early attempts to examine tissues lacked the necessary clarity, he did not give up. He sought new approaches to preparing samples, to illuminating them, to comparing them. His pursuit of truth was not academic curiosity, but an urgent need to save lives. He was not afraid to admit that the old masters were mistaken. He sought new paths, relying solely on unbiased data obtained from the bodies of the deceased and the suffering. This report did not cause an immediate sensation. The world did not change overnight. Many colleagues could not or would not see what Hodgkin had seen. They lacked his patience, his meticulousness, his vision. But a seed had been sown. A seed of new thinking, a seed of hematology, a seed that would germinate decades later when other physicians, building upon his work, would finally be able to name and define the disease that Thomas Hodgkin had first observed. Thomas Hodgkin's report was published, but the world did not immediately embrace it with recognition. Most physicians, entrenched in centuries-old dogmas, simply did not notice his work or chose not to. To them, these were just the strange observations of a young doctor using a curious toy, a microscope. The authorities of the medical world lived in a different dimension. In their worldview, established millennia ago, there was no room for new diseases, especially those hidden at the cellular level. Disease was an imbalance of humors, not an anomaly of tissues. Why seek something new when all answers had already been provided by Hippocrates and Galen? Criticism was not long in coming. It wasn't an open rebellion, it was more like caustic dismissal. Hodgkin was accused of excessive meticulousness, of digging around where there was nothing but laudable pus or bad humors. Some explicitly stated that his methods were too complex, his conclusions far-fetched. How could one trust what was only visible through glass lenses? True medicine, they believed, was about pulse, complexion, and the tongue, not some invisible cells. His views on hygiene, on the necessity of thoroughly washing hands, and on instrument cleanliness also met with resistance. This was an insult to respectable doctors who considered themselves above such trifles. His rejection of bloodletting? That was an assault on the foundations of their craft. Hodgkin, in their opinion, wasn't just looking for new diseases. He undermined their authority. He challenged their entire world, built on centuries of tradition and hierarchy. His colleagues, especially those who held high positions, saw him as a threat not only to their knowledge, but also to their status. They tried to ignore his work. His reports were rarely discussed. His conclusions were disregarded. Sometimes he was ridiculed for excessive pedantry. There were attempts to remove him from important research, diverting him to routine, less significant tasks. But Hodgkin also had his defenders. Not everyone at Guy's Hospital was blind to his vision. Some senior physicians, individuals with more open minds, saw the potential in his work. They observed that Thomas's patients, despite all his peculiarities, recovered more often, or at the very least, their suffering was alleviated. Among his patrons, Benjamin Harrison stood out, the treasurer and de facto head of Guy's Hospital. Harrison was not just an administrator, he was a far-sighted manager who understood that the future of medicine lay in science, not superstition. He saw Hodgkin not as an eccentric, but as a person capable of true discoveries. It was thanks to Harrison that Hodgkin gained access to the morgue, to laboratories, and to rare microscopes. Harrison protected him from the attacks of conservatives, granting him a freedom for research that other physicians did not possess. Another pillar of support was Dr. Richard Bright, one of Guy's Hospital's most distinguished physicians. Bright himself was a pioneer, having described the kidney disease that would later bear his name. He understood the importance of pathological anatomy and trusted Hodgkin. He saw how Thomas methodically gathered evidence, how his hands worked confidently with the scalpel and microscope. Bright not only supported Hodgkin verbally, but also provided him with patients for research, trusting his unique approach. These individuals, visionaries of their time, stood behind Thomas Hodgkin. They believed in him. They saw how his empirical method, his meticulous attention to detail, and his rejection of outdated dogmas yielded real results. They understood that truth is born not in arguments, but in facts. And these facts, though not immediately, paved the way for a new medicine. However, these visionaries did not just stand behind him. They provided him with support. They gave him a platform. Thomas Hodgkin was destined not merely to survive this struggle, he was destined to triumph. Not in loud debates at society meetings, where words drowned in the swamp of dogma. His victory was forged in the quiet of the morgue, in the halls of Guy's Hospital's anatomical museum. The position of curator of Guy's museum, which he obtained even before the publication of his fateful report, became his fortress. This was not just a place for storing exhibits, it was a research hub, a living library of diseases compiled from thousands of bodies. And Hodgkin, thanks to Harrison's support, gained full, unhindered access to it. He didn't just curate, he built, he systematized, he transformed a chaotic collection of specimens into a scientific database. In those years, while other physicians clung to outdated books, Hodgkin created his own. His book consisted of tissue sections, slides, and preserved organs. Every jar, every specimen in Guy's museum was part of his monumental research. He didn't just describe, he compared, he classified. He sought recurring anomalies, the very patterns that others ignored. This painstaking, methodical work became his answer to criticism, his proof. He did not stage public debates. He did not write accusatory articles. Instead, he taught. He lectured on pathological anatomy right in the museum halls, amidst his specimens. His audience consisted of young physicians, students, those who had not yet been infected by the dogmas of past centuries. He showed them what he had seen. He taught them not to take things at face value, but to observe. He taught them to analyze. His lectures were distinguished by their radical novelty. He did not quote Galen, he demonstrated real pathologies. He used the microscope not as a curiosity, but as a tool revealing a new reality. He taught them to prepare the thinnest sections, to see cellular changes, to understand that disease was not an imbalance of mythical humors, but specific changes in tissues. This was a vibrant, practical education based on facts, not theories. Gradually, a circle of students and followers formed around Hodgkin. They saw his results. They saw how his patients, whom he denied bloodletting and emetics, survived where others died. They learned his method, observation, systematization, the search for causes. He didn't shout about being right, he demonstrated it. It was during this period, despite the ridicule of conservatives, that Thomas Hodgkin transformed from an eccentric into a recognized specialist. His authority grew not in the offices of officials, but in the hearts and minds of those who genuinely wanted to save lives. He became more than just a physician, he became a teacher, the founder of a new approach to diagnosis and understanding disease. He laid the foundation for an entire generation of physicians who, building upon his method, would be able to make their own breakthroughs in the future. His victory was not in the immediate recognition of his great discovery, but in the establishment of the method of discovery itself, a method that forever changed medicine. He proved that truth does not require grand pronouncements. It needs facts and tireless effort. His tireless work bore fruit. Hodgkin's method, based on the detailed study of tissues, gradually permeated medical practice. Young physicians, trained by him within the walls of Guy's Hospital, began to apply his principles. They demanded facts. They sought causes within the body, not in ancient texts. This changed treatment protocols. Bloodletting, considered a panacea for centuries, began to recede into the background. Physicians, following Hodgkin's example, started to doubt its effectiveness. They saw that weakening a patient to the brink of death does not help. It kills. Emetics and purgatives, which debilitated the body, were used less and less. Doctors realized these methods do not heal, they only exacerbate suffering. The shift from symptomatic treatment to seeking the true cause of disease had measurable consequences. In wards where new approaches were applied, mortality from fevers and inflammations began to decline. For example, if previously up to 40% of patients with severe infections died from bloodletting, this figure now dropped to less than 20%. This was not an instant revolution, it was a slow but steady shift. Diagnostic accuracy increased. Physicians stopped grouping dozens of different ailments under the general term fever. They learned to distinguish tuberculosis from pneumonia and tumors from chronic inflammations. This opened the way for more targeted treatment. Although specific therapies for many diseases, including lymphoma, would only appear decades later, the very ability to make an accurate diagnosis saved lives. It allowed for the avoidance of harmful interventions. It gave physicians an understanding of what they were dealing with. Institutional changes followed this breakthrough. Departments of pathological anatomy, similar to Guy's Museum, began to appear in other major hospitals across Britain. Medical schools began to incorporate microscopy and histology into their curricula. Students were taught not just to memorize books, but to examine tissues themselves. They learned to prepare sections. They learned to see. Lectures on pathological anatomy, once considered exotic, became mandatory. Physicians who had undergone this training were armed with a new instrument of knowledge. They didn't just treat, they diagnosed. They understood. This was the foundation upon which all modern medicine would be built, a foundation laid by Thomas Hodgkin, a man who dared to ask why and found the answer not in old dogmas, but in reality. His name is forever attached to the disease he first described, giving it form and a name in his records. But Thomas Hodgkin's story is not merely a chronicle of a single medical discovery, however revolutionary. It is an account of how one man, driven by deep compassion and an insatiable thirst for truth, laid the foundation for modern pathology, transforming a quiet morgue into a battlefield for scientific knowledge. He showed how methodical observation and the fearless rejection of centuries-old misconceptions could offer a new perspective on disease and change the approach to diagnosis. And herein lies his main paradox. Having barely established a new method in medicine, Thomas Hodgkin did not rest on his laurels. His path led further beyond hospital walls to another continent, where he fought for the freedom and future of entire nations, building a new state in West Africa. His life is a refutation of the myth of sudden flashes of genius, of solitary epiphanies that change the world overnight. It teaches us that true progress, slow, arduous, often unrecognized in its time, is born not from loud pronouncements, but from painstaking labor, from an indefatigable struggle for humanity that knows no bounds of profession, continent, or era. Thomas Hodgkin proved that saving lives is possible not only with a scalpel, but with words, actions, and one's entire life, dedicating it to serving people wherever and whenever needed.